Mr. Louis Ng, next question.
The Ministry of Health regularly reviews the evidence surrounding tobacco control policy and is continually enhancing its efforts to further reduce the prevalence of smoking in Singapore through public education, provision of smoking cessation services, legislation and taxation. As previously explained in this House, the National Environment Agency, NEA, is constantly looking out for reasonable and practical solutions to further strengthen our efforts to address the harms of second-hand tobacco smoke. Smokers should also exercise social responsibility by refraining from lighting up in places where the second-hand tobacco smoke can affect those around them, including their families and loved ones, in order to protect their health.
Mr. Louis Ng.
Thank you, sir. I thank SMS for all her replies on second-hand smoke over the years, but could I just ask whether there's a threshold we need to reach before we will look into reviewing our policies and legislation, perhaps? Is there perhaps a certain number of deaths or a number of people who are affected by this before we would change? And I ask this because we really know that it does cause death, it does cause physical harm to our health, but now we realize even our mental health. So what more will it take before we are willing to amend our policies? Thank you.
Firstly, let me say that whilst there's evidence of a link between second-hand tobacco smoke and mental health condition, such as depression, anxiety, attention deficit, hyperactivity disorder, and so on, the evidence is currently inconclusive as to whether the second-hand smoke exposure directly causes this mental health condition or is simply associated with these mental health conditions. That means it is a sign that it's an environment that contributes to these mental health conditions. Just to explain your earlier query, but notwithstanding this, let me assure the member that we are as concerned about the harmful effects of second-hand tobacco smoke on non-smokers. And in fact, that is the reason why over the decades, we have put in tremendous effort and resources to reducing the prevalence of smoking through various efforts, as I've said, whether it's education, provision of cessation services, legislation, taxation, as well as constantly looking out for reasonable and practical solutions to further strengthen these efforts to address the issue of second-hand tobacco smoke. So for instance, this month, 1st October 2022, we have further extended the smoking prohibited areas to additional public gardens and parks, as well as ABC water sites and 10 recreational beaches, including that in Sentosa, which means that as of now, some 50,000 places, they are banned where smoking is prohibited. So we will continue, as I've said, to look at how we can strengthen our efforts, both MOH, HPB, NEA, and the various stakeholders. We will consistently look at the evidence as well as the solutions available, and will not hesitate to adjust or review this where appropriate.
Short SQ, please, Mr. Ng.
A short one then. If I could ask SMS, we're doing so much to protect people from second-hand smoke in the public areas. Could we apply similar efforts to protecting them at their own homes? It seems strange. When they're out there, they're all protected, but then when they reach home, they keep smelling second-hand smoke. Two, I'm in touch with the researchers. So if we can provide some conclusive evidence that is linked to mental health, will MSC then amend our policies? Thank you.
Again, as I've said, we are concerned about the harmful effects of second-hand tobacco smoke, notwithstanding whether it is, it leads to depression, etc., because we know that second-hand tobacco smoke also increases the risk of cancer. So there is no doubt that we are as concerned. regarding second-hand tobacco smoke in homes, I think I have reiterated my answers many times. I don't think I need to repeat them again. Thank you.